Ultra Freeda is a multivitamin and iron product that is used to treat or prevent vitamin deficiency. It is especially helpful for those with poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for maintaining good health and are important building blocks for the body. It is recommended to take Ultra Freeda daily according to the recommended dosage on the packaging. It is best to take it with a meal to enhance absorption. Consult with a healthcare professional for the best timing to take this medication. It's best to take Ultra Freeda by mouth, usually once daily or as directed by your doctor. Take it on an empty stomach, 1 hour before or 2 hours after meals, with a full glass of water unless directed otherwise. If you experience stomach upset, you can take it with food, but avoid antacids, dairy products, tea, or coffee within 2 hours before or after taking the medication as they may decrease its effectiveness. If you're taking the delayed release form or extended release capsules, swallow them whole and do not crush or chew them. Taking the medication regularly at the same time each day will help you get the most benefit from it. Remember not to take more than the recommended dosage, and if you have any questions, ask your doctor or pharmacist for more details on your specific brand. If you experience constipation, diarrhea, or an upset stomach when taking Ultra Freeda, know that these effects are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, make sure to contact your doctor or pharmacist right away. Iron in Ultra Freeda may cause your stools to turn black, but this is not harmful. Your doctor has prescribed this medication because they believe that the benefits to you outweigh the risk of side effects. Most people using Ultra Freeda do not experience serious side effects. Although it is rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. Remember, in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. And in Canada, you can report side effects to Health Canada at 1-866-234-2345. Always consult your doctor for medical advice about side effects. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. Keep this product out of reach of children. If overdose does occur, get medical help right away or call a poison control center. It is important to take Ultra Freeda as directed by your healthcare provider. Do not exceed the recommended dosage. Ultra Freeda is typically taken once daily, with or without food. It is best to take it at the same time each day to help you remember. If you miss a dose, take it as soon as you remember. If it is near the time of your next dose, skip the missed dose and resume your usual dosing schedule. Do not double the dose to catch up. Before using Ultra Freeda, make sure to inform your doctor or pharmacist if you have any allergies to its ingredients or any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other issues. It's important to discuss this with your pharmacist for more information. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your brand of multivitamin contains folic acid, let your doctor or pharmacist know if you have a vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia, which could lead to serious nerve problems. Make sure to consult your doctor or pharmacist for more details. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to discuss with your doctor before using this medication. Remember to consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines. Ultra Freeda may decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate your doses of these medications as far as possible from your doses of Ultra Freeda. If your multivitamin also contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. Additionally, Ultra Freeda may interfere with certain lab tests, so make sure your lab personnel and doctors are aware that you are using this medication. If someone takes too much Ultra Freeda and has severe symptoms like fainting or difficulty breathing, they should call 911 immediately. Otherwise, they can contact a poison control center for help. In the U.S., residents can call 1-800-222-1222 for their local poison control center. In Canada, they can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It is important to take the recommended dosage of Ultra Freeda and seek medical help if an overdose occurs. Always follow the instructions on the label and consult with a healthcare professional if you have any concerns. Remember, if your doctor has prescribed Ultra Freeda, it's important not to share it with others. Make sure to keep all your medical and lab appointments. Some brands of Ultra Freeda may also contain ingredients like docusate. If you have any questions about the ingredients in your brand, be sure to ask your doctor or pharmacist. It's also important to remember that Ultra Freeda is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods, so be sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. If you forget to take Ultra Freeda at your scheduled time, take it as soon as you remember. If it's close to your next dose, just skip the missed one. Don't take extra to make up for it. Also, make sure to take it at the same time every day. When storing Ultra Freeda, make sure to keep it at room temperature and away from light and moisture. It's important to keep all medications out of reach of children and pets. Also, do not flush this medication down the toilet or pour it into a drain, unless specifically instructed. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.